Osteofibrous dysplasia is a benign lesion of the kids. It develops as anterior cortex tibia thickening with anterolateral bowing of the tibia, also called ossifying fibroma. It is painless. X-ray will be shown, which shows a anterior cortical environment, especially proximal 1/3. No soft tissue lesion found or periosteal reaction. Treatment is observation. It can progress to adamantinoma, which is a low-grade malignant tumor, and osteofibrosis dysplasia needs bracing. Regarding adamantinoma, it's a low-grade tumor, most commonly anterior part of the tibia, happens in the second and fifth decade, needs a wide surgical excision or amputation. These patients will complain of pain, swelling, and a bulge. There can be a possibility of regional lymph node involvement, and treatment can be allograft resection with reconstruction. Differential diagnosis of adamantinoma: giant cell tumor, fibrous dysplasia, and residual bone cyst, chondrodysplasia, chondromyxide fibroma, and as per the histology, it is epithelial cells trapped at the fetal time. They are keratin positive cells and has adamas, meaning diamond, so it has adamantamine epithelium in histology.